Chris Theogaraja here at Park Avenue Oculoplastic Surgeons. Today I'm here to talk about the internal approach to ptosis repair. Eyelid lifting has different techniques that can work to raise or open the eyelid. There are three primary ways that are done in the eyelid specialist world. The first is tightening the levator muscle. That's called the levator resection. The second is an internal ptosis repair, which tightens a different muscle called the Mueller's muscle. And the third is using something called a sling, which if the muscles are weak or have been malformed, we connect the eyelid essentially to the brow using either silicone or the patient's own tissue. Today I'm here to talk about the internal ptosis approach, which is something that I've been doing for some time now. It was introduced to me by Srini Iyengar, who is a very well-known oculoplastic surgeon in San Diego at San Diego Eyelid Specialists. He has used that for quite some time, and as a result, that technique, he really has convinced me that it's a much better technique. And by me using that over the last couple of years, I myself have seen that gives a better contour and height and predictability for the eyelid lifting. How do we do an internal ptosis repair? Well, the steps are pretty easy. The muscle that we're tightening is on the inside of the eyelid. We flip the eyelid. We essentially make some measurements, place a clamp that pinches off the tissue we're trying to tighten, place a suture that tightens the tissue, cuts off the loose amount of tissue that's there, and then we put the eyelid back into the normal position. These few steps take roughly 15 to 20 minutes at most on either side and work predictably well. How much tissue we're going to tighten or remove is based on an algorithm which gives a 90 to 95% predictability that it will work. In order to use this technique, though, in the office, I have to place a drop in the eye, and that drop has to raise the eyelid. And that allows the patient to be a good candidate for this technique. It's a great technique, internal ptosis repair. There are no cuts on the skin surface, so patients heal very quickly, and it has given us really good results here at Park Avenue. I'm Chris Theogaraja. Hopefully that was helpful in going over ptosis repair and internal ptosis repair. Thanks so much.